now more and more healthcare workers are obviously at the front line, and but they have lives to lead, they have families to lead, and they go home. How should they be protecting their families?
Yeah, I get a lot of those questions, and I, of course, have great empathy for them. I would say several things. The ideal thing, we're talking about frontline healthcare workers, the ideal thing is that you wear scrubs and a lab coat, and you put those on when you come into the facility, you take them off when you go out of the facility, and you don't wear those clothes home. Mm-hmm. Number two, something I know some of my colleagues didn't think of, there's no reason to take your stethoscope home with you. Your stethoscope is something that you ought to be cleaning between patients anyway. We have the tradition of wearing a coat and tie, as you and I are right now. Mm-hmm. You don't want your tie trailing onto the patient and then going to the next patient. Not that I know that that's any kind of valid way of transmission, but we know that viruses and bacteria are harbored on our clothing. The other thing, and you cannot emphasize it enough, is high quality hand sanitizing. You really do not only have to use hand rub between patients, but you've got to wash your hands well before you go home. You're a surgeon, and surgeons and infection control people are the only people I've ever seen wash their hands properly. And when you think about it, we tend to concentrate on our palms and the lower third of the digits, but that's not what goes in your eyes, nose, and mouth. It's your fingertips. Yeah. And people ignore that. So that's really important to do.